Hello everybody, my name's Joanne Boyle. I'm a SAC funded development officer for North Lanarkshire Council's Family Learning team. My colleague Louise McLean's joined me today, and our improvements manager David Young, and some of our colleagues as well from Education and Families, Tim Sharp and Ian McCauley, who have been involved in some of the stuff that we're going to talk about today. Hopefully our presentation will give you a wee bit of a snapshot in terms of partnership working in North Lanarkshire and what that looks like. Oh, sorry, can you hear me? Is that all right? And what that looks like in North Lanarkshire. So our CLD service, we know that we're very privileged in terms of having a very distinct service within the authority. As part of that team, it encompasses 4 teams, essentially 4 staffing teams. That would be our community-based youth work team, our adult learning team and resettlement, the family learning team and parental engagement team that myself and Louise sat under, and the homeschool partnership officers that was previously mentioned. Sheila had mentioned Bells Hill earlier on. For the purposes of today's presentation and some of the stuff that we're going to talk about in terms of data and potential processes that we've piloted as part of our role, sits within the family learning team. So I'll give you a wee bit of a breakdown in terms of that specific team. So we've got 1 family learning manager, we've got 18 CLD full-time equivalent schools workers, we've got 8 CLD home-link full-time equivalent home-link staff, and we've got 7 support workers who would be classed as probably part-time workers. In addition to that team just now is the 3 posts that myself, Louise and Emma are currently being funded through SAC to come in and look at, supporting the work for that team, but also looking at how can CLD work with our partners to look at closing that attainment gap, around poverty. Who does this team work with? So, the priority, I suppose, for our staffing teams within the family learning team is the adult and parent. That focus around parenting work and the learning offer, they wouldn't distinctly be working directly with children. They would take that full holistic family approach and working with the kids. The CLD schools workers would be linked to the primary school establishments, so children and families within that primary school setting, and the home link staff are linked to our early learning centres, focusing around parenting from birth to 3 months. So in terms of partnership, again, I don't want to, reiterate the great presentation that John gave earlier around policy and setting that policy landscape. However, in CLD we talk about the golden thread and, how do we link, the work that we do right on the ground, right up to that national policy. So if we consider the National Performance Framework and the National Improvement Framework, link that into GIRFIC. When that comes down locally to us in North Lanarkshire, we do have the plan for North Lanarkshire and also the CLD partnership plan. So within the 2 documents, it allows us as a team to develop. We have also, as part of our role, been involved in creating a family learning strategy, which would encompass the outcomes and ambitions within these, documents to allow us to really target the work that we're doing to target, vulnerable children, families and adults. In terms of a CLD context, again, building on what John was saying around the competencies, we do have a professional standards council who looked at 7 competencies, I suppose. One of them is to develop and support collaborative working. So that really helps us to demonstrate quite confidently, that the work and the approach that we take in terms of CLD really is underpinned by, partnership working. So we do understand the importance of that and the impact that it can have. For us, when we see partnership working done, in a really meaningful way, some of the, the benefits that we see from that are, that shared language, building our own capacity around the understanding of our partners and what we can expect from each other, understanding what we're actually asking from each other. One of the other things that, is part of a kind of model that we'll talk about shortly is maximising the resources that we've got available to us and utilising them in such a way, cutting down any duplication of services that are getting put into support families, that we're not going back into, provide a service that was maybe a negative experience, all of that kind of stuff as well. So one example in terms of partnership working that myself, Louise and Emma have been involved in was the introduction of a new empowerment cluster model in North Lanarkshire. So that was introduced last year, and that encompasses 23 school clusters across the authority. So myself, Emma and Louise, through the SAC funding, have been, as part of our role, is to link with our partners to look at building CLD support to our colleagues in education and social work, and streamline that support to, as I say, build the better partnerships. So for us, that model is based around the GIRFEC pathway. So there's been an introduction of a universal, additional and intensive level staged intervention. Now, based on the level of support that family would need at that time would depend on what level of they would fall into in terms of the staged intervention. The universal would be resources available to the school and education establishment for everybody. The additional might be some early intervention stuff where we're starting to see things dipping for families or, concerns. Our intensive level is when things, haven't quite worked out at the additional, I suppose, and then we can have the discussion to look at, well, how do we better put things in place to prevent, families moving from additional to intensive. This collaborative approach is made up of ourselves. We attend with education, social work, educational psychologists, virtual school, who have been set up to support children who are looked after and accommodated within North Lanarkshire, health, early years and our third sector and community organisations are a part of these conversations as well. In terms of the model, there's a kind of dual role within that. One would be to address the individual needs of families or children within the establishment. So we'll look at that, universal, additional and intensive resources, what is available, and help to support schools and our partners to put more sustainable outcomes in place for families or solutions for them. But the second part of these kind of meetings, I suppose, takes more of a kind of strategical focus where we look at wider issues for our local authority in terms of things like poverty, attainment, attendance. Is there things that we can share in terms of good practice within our own authority that we can share across our clusters? Can we introduce early intervention? Pilots or pieces of work that can help change processes that can really affect how schools and our partners can best support families. So that's the kind of two roles in terms of the kind of cluster model. Moving on to that, I'm going to pass to my colleague Louise, who will talk a wee bit about some of the developments within that and what we've been involved in, and it maybe give you a better idea of some of the conversations and the directions we've moved in with this new particular model. Right.
Okay. So building on what Joanne said, we thought it might be useful to come along today and just talk you through some of the developments that we've been involved in since we've come into post. And again, I think the first point really does tap into some of the conversation that's already happened this morning around supporting our partners to understand in terms of CLD, what is an offer, what does that look like? And depending on what our partners' experience of the service is, that can then influence what their knowledge of it is. So we've done a lot of work to work with partners and really break down and refine what the offers are across the authority. Another significant development has been that we have moved to a hybrid model, which we believe offers a more equitable offer in terms of the support from the family learning team to the schools. So I suppose there's two aspects to that. And to put it into context, we have over 120 primary schools in North Lanarkshire. In the CLD team, we don't have the resource to have a distinct service in every single school. So David, who's with us today, had worked with colleagues in education to look at the data around SIMD, free school meal and clothing grants, and we identified 20 schools across the authority that would be a priority for CLD input in terms of the family learning team. In addition to that, we brought in a formalised referral process that the other 100 schools can use to access the service via the request for assistance, which is the approved GIRFEC paperwork. And we set up a centralised mailbox We developed process maps, we wrote papers, and we distributed that across our partners so that there was clarity on how to access the service. Because again, what I'm picking up this morning is some of that discussion about we might know it's there, but actually how do we access that? So that's work that we've been doing and that we will continue to do. And also we've got a lot of data from those referrals that have came in. Once we receive them, we track those referrals. But again, I'll come on to some of that later on. That has then led us to adapt our information management system. We use the Cognisoft system to capture the work that the staff are doing across the service. And again, that's going to link into, our outcomes. We recognise that it would be useful to have the referrals as part of the system. So when we receive a referral through the mailbox, the development officer team, we would link that to the member of staff on the service, and then we can track the journey of that parent through that system. Now, at the moment, that's been piloted with the family learning team, but again, looking at the successes from that may be something that we would hope to roll out across the service. Another aspect that we've looked at developing is what we would term as flags. So essentially what we're looking to do is capture within the information management system some of that work that's going on in the ground. So when we're talking about the poverty agenda, we know that our staff are making referrals to food banks, to financial inclusion, and that has only increased through the last 2 years. So we have introduced a mechanism on our information management system to capture that. Now, we're not in a position to report on it today because it's so new, but we hope to do that in the future. Joanne's already mentioned about the GIRFEC pathway, and again, having had a year's experience and also, the way we worked had to change in response to the pandemic. We moved to a lot of one-to-one work, garden visits, dropping off food packages. But again, we're moving back to that universal and additional offer, mainly group work-based, and away from the one-to-one intensive offer. But again, the data that we've had from our referral system has also enabled us to look at where the service is most effective. Family learning outcomes, we thought it would be important to note that within the family learning team, we have just updated our outcomes. Our prior outcomes were based on curriculum for excellence, but the policy landscape in terms of CLD has changed quite considerably since we first introduced them. So we have introduced some new outcomes, and they have literally last week, I think, went live on the information management system. So again, we're at the start of that journey, but what we'll be looking to do is to track them, track the evidence, look at self-evaluation, and again, we'll be able to report on that in the future. And I suppose another key role in development has been training. The role that myself, Joanne and Emma have had is very much about supporting the practice of the team. And I suppose one example of training in response to the pandemic has been Sleep Scotland. The number of families who were saying that actually routines within the house, sleep, has just, been literally all over the place since the pandemic, and that impacts on attendance at school, attainment. So we invested in the family learning team being trained in Sleep Scotland, and again, we're starting to take those referrals and we can track that through our new process. So again, I'm not going to go into this in any great depth, but we thought it was important to give you some of the stats in terms of the work that the team have been doing. So when we talk about unique clients, that's the parent, the primary parent or carer that we are engaging with within the family learning team. So for family learning specific programmes within, the year from April 21 to March 22, we've had 613 for family learning and 448 for parenting. Now again, we anticipate those numbers are going to increase because a lot of that work would have been on a one-to-one nature given the conditions and the restrictions. In terms of the referrals the new referral pathway that I've mentioned, we can now confidently report that within that timescale we've had 201 referrals came in through that pathway that were appropriate referrals and that have then went on to the system. Now that's in addition to, that's not including the referrals that are coming in from those priority primary schools that I mentioned in the last slide. All right, and again, over 50% of the families engaging with us are living in SIMD 1 and 2. Again, we anticipate that number is going to increase. So again, just a bit of a note to some of the next steps, that this is a journey that we're on, and we're continually looking at the data and learning. And again, I think some of the discussion today has been, it's useful to have data, but it needs to be meaningful and it needs to inform our next steps in our practice. So that's what we're really trying to do at the moment. And as I say, we recognise there's still further steps on this journey to be taken. Another aspect in terms of the systems and the reporting has been to support staff in some training sessions around the information management system so that they feel confident in how they're navigating the system, because we're only going to get the system's only as good as the data that goes into it. So that's an important part of it for us. And also just to note that our number of adults engaging in family learning will be reported nationally via CLDMs in terms of, the number across Scotland. All right. So in terms of our priorities moving forward, I know there's a big long list and I'm not going to go through every one of them, you'll be pleased to hear. But I suppose I'm going to pick up on a few of them. And I think, again, we're continuing to develop how we target our vulnerable families, because we recognise that the poverty agenda is such a huge agenda that it's not something that any one service is going to tackle alone. We very much have to work in partnership, and we are continuing to develop how we can more confidently target those families and engage with them, and also increase the number of families we're working with. Again, I've mentioned the self-evaluation framework, and again, we're looking to improve our arrangements for cross-team working. As Joanne mentioned, we have 4 teams, but it's that linkage across, the service and across our communities. Contextualised safeguarding approaches, we're at the beginning of that journey as well, and that's something that certainly we're looking at across the CLD teams and also with partners, and those discussions are coming up through the clusters as well. And we, in terms of, we lead on the Youth and Parent Voice subgroup on behalf of the Children's Services Partnership. Another development in terms of the work we've done is we have developed a parent voice for parents who are engaging with the CLD service. And I would say they are parents who would be deemed as vulnerable parents and who would not be engaging in some of the more formalised processes around, parent councils and so on. So again, we're at the start of that journey, and we hope that that's going to continue to develop and grow. And again, continuing to map out the parents' journey to address gaps in the service so that we can, make sure that we're working with the right people. And that's us. So we just wanted to give an opportunity in case anyone had any questions they wanted to ask us today. That's okay. But thank you very much for your time today. And likewise, myself and Joanne's contact details are there. And also we've put our Facebook and Twitter details as well. So, but again, if anyone leaves here and wants to get in touch to discuss this or anything else in relation to the work we're doing, then we would welcome hearing from you. All right, but thank you very much.